Welcome to this educational video about orbital pseudotumor, also known as idiopathic orbital inflammatory syndrome. This condition might sound intimidating, but understanding it can empower you or your loved ones facing this challenge. We'll break down the causes, symptoms, diagnosis, and treatment options in a clear and concise way. Let's dive in. The exact cause of orbital pseudotumor remains a mystery, hence the term idiopathic, meaning of unknown cause. It's not an actual tumor, despite the name. Instead, it's thought to be a type of autoimmune disorder, where the body's immune system mistakenly attacks the tissues within the eye socket, leading to inflammation. While the precise trigger is unknown, potential links to underlying systemic inflammatory conditions or infections have been investigated, but a definitive connection is often difficult to establish. The pathophysiology of orbital pseudotumor involves a complex interplay of inflammatory cells infiltrating the orbital tissues. This infiltration can affect various structures, including the muscles controlling eye movement, the optic nerve, the lacrimal gland responsible for tear production, and the fatty tissues surrounding the eye. The resulting inflammation leads to swelling, congestion, and potentially damage to these tissues, which manifest as the various symptoms we'll discuss later. Orbital pseudotumor is considered a relatively rare condition. It can affect people of all ages, including children, though it's more commonly diagnosed in middle-aged adults. There's no known gender predisposition, meaning it affects men and women equally. While not directly inherited, some research suggests a possible genetic susceptibility in certain individuals, although more studies are needed to confirm this. The signs and symptoms of orbital pseudotumor can vary depending on the extent and location of the inflammation. Common symptoms include proptosis, which is bulging of the eye, pain around the eye or during eye movement, double vision, swelling and redness of the eyelids, decreased vision, and sometimes a droopy eyelid, also known as ptosis. Some individuals may also experience headache or pain radiating to the forehead or temples. The symptoms often develop rapidly, over days or weeks, distinguishing it from more chronic conditions. Diagnosing orbital pseudotumor can be challenging as its symptoms can mimic those of other orbital conditions. The diagnostic process typically involves a thorough clinical examination by an ophthalmologist, including assessment of visual acuity, eye movements, and pupillary responses. Neuroimaging, such as CT scans or MRI of the orbits, is crucial to visualize the inflamed tissues and rule out other potential causes, like tumors or infections. A biopsy of the orbital tissue may be performed in some cases to confirm the diagnosis and exclude malignancy. It's important to note that diagnosis is often based on excluding other possible causes, making the process sometimes lengthy and requiring careful evaluation. Orbital pseudotumor can be classified based on the anatomical location of the inflammation. For example, it can be classified as anterior, affecting the front of the orbit, posterior, affecting the back of the orbit, or diffuse, involving multiple areas. It can also be classified based on the tissues primarily affected, such as myositis, which affects the eye muscles, dacryoadenitis, which affects the lacrimal gland, or optic neuritis, which affects the optic nerve. These classifications help guide treatment decisions and predict the potential course of the condition. The primary goal of treatment for orbital pseudotumor is to reduce inflammation and alleviate symptoms. Corticosteroids, such as prednisone, are the mainstay of treatment. These medications are typically administered orally, and the dosage is gradually tapered down as the inflammation subsides. In cases where corticosteroids are ineffective or cause significant side effects, other immunosuppressant medications, such as methotrexate or azathioprine, may be used. In rare instances, radiation therapy may be considered. It's crucial to work closely with an ophthalmologist and potentially other specialists, like a rheumatologist, to develop an individualized treatment plan. Unfortunately, because the exact cause of orbital pseudotumor is unknown, there are no specific preventive measures that can be taken. Maintaining a healthy lifestyle, managing underlying autoimmune conditions, and avoiding potential triggers, if identified, may help to minimize the risk of recurrence. Regular follow-up appointments with an ophthalmologist are essential for monitoring the condition and detecting any potential complications early on. The prognosis for orbital pseudotumor is generally good with prompt and appropriate treatment. Most individuals experience significant improvement in their symptoms with corticosteroids or other immunosuppressant medications. However, recurrence is possible, and some individuals may require long-term maintenance therapy to prevent flare-ups. Recent research is focused on identifying specific biomarkers that can help predict treatment response and identify individuals at higher risk of recurrence. Advances in targeted therapies and a better understanding of the underlying immune mechanisms are paving the way for more effective and personalized treatment strategies in the future. Thank you for watching.